If you are over 60 and you have a heart, and you do, what happens in the 2 hours before you go to sleep tonight matters more to your cardiovascular system than most people realize. Not in a vague, general way. In a documented, measurable, biological way that cardiologists have been studying for decades. There are 5 specific evening habits that directly interfere with your heart's ability to recover overnight, and every single one of them feels harmless. That is what makes them dangerous. Let's start with what your heart actually does at night, because without this, the rest of this will not land the way it needs to. Your heart does not clock out when you fall asleep. It shifts into recovery mode. In a healthy cardiovascular system, blood pressure drops naturally by 10 to 20% during the sleeping hours. Your heart rate slows, arteries relax, inflammatory markers settle. Doctors call this the nocturnal dip, and it is one of the most protective things your body does for itself every single night. It is when your heart repairs, restores, and prepares for another day. After 60, this system becomes more fragile, not because something is necessarily wrong with you, but because of normal age-related changes that nobody explains clearly enough. Blood vessels gradually stiffen with age. The autonomic nervous system, which automatically manages your heart rate and blood pressure without you thinking about it, becomes less precise and slower to respond. The hormonal signals that trigger that protective nighttime drop begin to weaken. The result is a narrower margin for error. During the day, your cardiovascular system has backup mechanisms. It compensates. At night, many of those mechanisms go offline. What you do in the hours before bed determines whether your heart can hold things together safely until morning. This is not abstract. Heart attacks and strokes do not occur randomly around the clock. Research consistently shows they cluster between midnight and 6 in the morning, precisely when the body is most vulnerable and least monitored. The 5 habits coming up are the ones that most consistently push people into dangerous territory during those hours. The first habit is eating a heavy meal within 2 to 3 hours of going to bed. Think about last night. What time was dinner? How large was the meal? When you eat, your digestive system demands an immediate and significant surge in blood flow. Your heart works harder to meet that demand. Blood pressure rises. Triglycerides, the fats circulating in your bloodstream, spike sharply in the 2 to 4 hours after a large meal. Now place that entire biological process on top of the moment your body is simultaneously trying to shift into nighttime recovery mode. The 2 demands are in direct conflict. Your heart is fighting a 2-front battle, managing the metabolic work of digesting a full dinner while also trying to slow down and protect itself overnight. Studies published in cardiovascular research journals consistently show that eating within 2 to 3 hours of sleep is associated with elevated nighttime blood pressure, disrupted nocturnal dipping, and meaningfully increased cardiovascular risk during the sleeping hours. One research review found that people who ate late meals and then went directly to bed were substantially more likely to show what cardiologists call the non-dipping blood pressure pattern, the pattern most strongly associated with overnight heart attacks and strokes. The fix is simple and does not require a diet overhaul. Finish your main meal by 7 in the evening whenever you can. If your schedule makes that impossible some nights, keep the late meal genuinely light. Lean protein and vegetables rather than heavy fats, refined carbohydrates, or large portions that demand sustained digestive effort through the night. Your heart uses the hours after midnight to recover. A heavy late meal cancels that recovery window. The second habit affects more than 60% of adults over 60, and most of them have no idea it applies to them. It is taking blood pressure medication at the wrong time of day. If you take medication for high blood pressure, and statistically, there is a very good chance you do, there is something your doctor may never have mentioned, not because they do not care, but because a standard appointment rarely reaches this level of detail. Most people take their blood pressure medication in the morning. That is the common practice. But here is the biological problem with that timing. Blood pressure follows a predictable daily curve. It rises through the morning, peaks in the afternoon, and is supposed to drop at night. But a significant portion of people over 60, especially those with hypertension, do not get that protective nighttime drop. Their pressure stays elevated through the sleeping hours, or it surges in the early morning as the body transitions out of deep sleep. This is called nocturnal hypertension, and it is dangerous in a specific way that daytime high blood pressure is not. During sleep, your arterial walls are in a relaxed, vulnerable state. A pressure surge at 3 in the morning hits those walls differently than the same surge at 3 in the afternoon. It is significantly more likely to rupture a vulnerable plaque inside a coronary artery, more likely to trigger clot formation inside a narrowed vessel, more likely to produce a stroke from a blood vessel already under strain. If you take your medication only in the morning, its protective effect may be substantially diminished by midnight, precisely when you need it most. The HIA chronotherapy trial, one of the largest studies ever conducted on this specific question, followed over 19,000 patients for nearly 6 years. Patients who took their blood pressure medication at bedtime had nearly 45% lower rates of heart attack, stroke, and cardiovascular death compared to those who took the identical medications in the morning. Same drugs, same doses, different timing. Nearly half the cardiovascular risk. This is not a recommendation to change your schedule on your own. Some medications, diuretics in particular, genuinely should not be taken at bedtime. This is a conversation your doctor must be part of. But at your next appointment, ask one specific question. Should my blood pressure medication be taken at night rather than in the morning? Write that down before this video ends. That 2-minute conversation could be among the most important medical exchanges you have this year. The third habit is one that many people in this age group have been ignoring for years, sometimes for decades. It is sleep apnea, or more specifically, leaving it undiagnosed and untreated. Obstructive sleep apnea affects an estimated 30% or more of adults over 60. The vast majority have never been evaluated or treated. They have no idea what is happening to their cardiovascular system every single night while they sleep. Here is what actually occurs during an apnea episode. You stop breathing for anywhere from 10 seconds to over a minute. Your blood oxygen level drops. Your brain registers a physiological emergency and fires an immediate stress response. Adrenaline surges, cortisol releases, and both your heart rate and blood pressure spike dramatically. Your cardiovascular system jolts into emergency mode while the rest of you remains asleep. This can happen 30, 40, even 50 times in a single night. Every single episode is a cardiovascular stress event firing a pressure surge through arteries that are supposed to be resting. Across months and years, this pattern causes documented, measurable damage. It injures the endothelium, the delicate inner lining of your blood vessels. It accelerates arterial stiffening. It contributes to sustained hypertension, to plaque formation, and to irregular heart rhythms. The American Heart Association directly links obstructive sleep apnea to higher rates of high blood pressure, stroke, coronary artery disease, and atrial fibrillation, the irregular heart rhythm that is one of the leading causes of stroke in people over 60. Here is a number that should get anyone's attention who has been told their blood pressure will not come down despite medication. Research suggests that up to 70 to 80% of patients with resistant hypertension, blood pressure that fails to respond to 3 or more medications, have undiagnosed obstructive sleep apnea, not as a coincidence, as the underlying cause. If the trigger firing those pressure spikes dozens of times every night is never identified and treated, the medication will never fully do its job. The warning signs are not always the obvious ones. Yes, loud snoring is one, but also watch for waking up with a headache, feeling exhausted after a full night of sleep, needing to urinate frequently during the night, waking with a dry mouth, or a sensation of gasping. If any of those sound familiar, a sleep study is not optional. It is a fundamental part of protecting your heart. The fourth habit will surprise you because it is one of the most sensible, careful things a person your age can do. And from a cardiovascular standpoint, it carries a risk almost nobody discusses. Many people over 60 deliberately limit how much they drink after dinner. The reasoning makes complete sense. They want to avoid waking at 2 in the morning to use the bathroom. Disrupted sleep is exhausting. Nighttime trips to the bathroom carry a real fall risk with age. So they cut fluids after dinner, sometimes as early as 4 in the afternoon. It feels responsible. It feels disciplined. Going to bed even mildly dehydrated is a meaningful cardiovascular risk. When you are dehydrated, your blood becomes more viscous, thicker. It does not flow as freely through your vessels. For a young cardiovascular system, mild dehydration is a manageable inconvenience the body compensates for quickly. For a person over 60 dealing with arterial stiffness, reduced vessel elasticity, and the early stages of vessel narrowing, the picture is fundamentally different. Thicker blood moves slowly through already compromised arteries. It is significantly more prone to forming clots. And clot formation at 3 in the morning inside an artery that has been narrowing for years is exactly how a heart attack or stroke begins in someone who went to bed feeling completely fine. The timing makes it worse. During sleep, your heart rate naturally slows and blood moves more slowly through the system anyway. Now combine that slow circulation with thicker, more viscous blood in a body that has been lying still for 7 or 8 hours. That combination, dehydration, slow heart rate, reduced movement, and vessel disease, is one of the primary biological reasons cardiovascular events cluster in the early morning hours. The solution is one of the simplest in this entire discussion. Drink a full 8-ounce glass of water before bed, not a large amount that will disrupt your sleep. Just 1 one glass, enough to ensure your blood is not thickening unnecessarily during the most vulnerable hours of the night. Keep another small glass on your nightstand. If your body quietly wakes you at 2 in the morning, your heart is asking for the same thing. The fifth habit is the one that consistently surprises people most, and the one that appears most frequently when cardiologists review cases of overnight cardiac events in people over 60. Sleeping with any meaningful source of artificial light in your bedroom. A television left on after you fall asleep, a bright digital alarm clock, light coming through uncovered windows from a street lamp or a neighbor's porch light. The ambient glow of a phone left face up on the nightstand. Before you move past this, hear the research, because it is not marginal or preliminary. It is substantial, large-scale, and published in JAMA Network Open, one of the most rigorous peer-reviewed medical journals in the world. A 2025 study tracked nearly 89,000 adults over the age of 40 for 9.5 years. Participants wore wrist sensors that measured their actual nighttime light exposure, specifically how much light they were exposed to between 12:30 and 6 in the morning. Researchers then tracked cardiovascular outcomes across the following decade. The results were striking and have been discussed at the highest levels of cardiovascular medicine. Compared to people who slept in the darkest conditions, those with the highest levels of nighttime light exposure had a 47% higher risk of heart attack, a 56% higher risk of heart failure, a 32% higher risk of coronary artery disease, and a 28% higher risk of stroke. These findings held firm even after researchers adjusted for physical activity, diet, smoking, sleep duration, socioeconomic status, and every other established cardiovascular risk factor. The light exposure was an independent risk factor, standing on its own, separate from everything else. The mechanism runs through your body's circadian rhythm. Your circadian system governs blood pressure patterns, heart rate variability, cortisol secretion, platelet activation, inflammatory markers, and the tension inside your arterial walls. Your body reaches peak sensitivity to light signals between midnight and 6 in the morning. Even low-level ambient light during that window, the glow of a television you fell asleep in front of, sends a signal to your body's master clock that daylight is arriving. Blood pressure, which should be dropping into its protective nighttime dip, stays elevated or begins rising earlier than it should. Stress hormones that should be settling remain partially activated. The protective cardiovascular recovery that the night is supposed to provide simply does not happen. And night after night, the cumulative damage builds invisibly while you sleep. Margaret was 71, a retired school teacher, remarkably healthy by every standard measure. She had a checkup 4 months before her stroke, and her doctor said everything looked good. She had no history of heart disease, no obvious risk factors, and no symptoms. What she did have, every single night for years, was a television that stayed on through the night, a bright cable box clock, and uncovered windows that let in light from the street. She recovered, thankfully, but her recovery was long and difficult. When we talked through her evening routine together, every one of the 5 habits in this discussion was present. She told me she had no idea any of it mattered. That is the conversation this discussion is trying to have before something happens, not after. Here is what all of this means practically, because information without action does not protect anybody. 5 habits, all 5 documented contributors to overnight cardiovascular risk in people over 60, all 5 changeable starting this evening. Eating a heavy late meal forces your heart to work through the night instead of recovering. Wrong medication timing leaves your blood pressure unprotected during the hours when a pressure surge causes the most arterial damage. Undiagnosed sleep apnea triggers dozens of cardiovascular stress events every single night, firing adrenaline surges through a heart that is supposed to be resting. Going to bed dehydrated thickens your blood at the precise moment clot formation risk is highest. And sleeping with light exposure disrupts the circadian signals that regulate blood pressure, heart rate, and vascular recovery during sleep. None of these require surgery. None require a new prescription. All 5 can begin changing tonight. Here is your specific protocol for this evening. First, finish your main meal at least 3 hours before bed. Tonight, not eventually. Second, drink a full 8-ounce glass of water before you lie down. Third, walk through your bedroom right now and look honestly at the light sources. Is there a television that stays on? A bright clock face? An uncovered window? Make it as dark as you can make it. Blackout curtains? A small piece of tape over a bright clock display, a sleep mask if needed, use whatever works. Fourth, write down 2 questions to bring to your next doctor's appointment. Whether your blood pressure medication should be taken at night rather than in the morning, and whether you should be evaluated for sleep apnea. Those two questions are worth more than most things discussed in a standard checkup. The single most important takeaway from all of this is straightforward. Your heart uses the night to recover, and what you do in the hours before you sleep either supports that recovery or works against it. The 5 habits described here work against it, quietly, invisibly, and cumulatively, but they are also 5 of the most changeable risk factors in cardiovascular medicine. That is genuinely good news. Margaret now sleeps in a completely dark room, her television goes off before she gets into bed, and she keeps a glass of water on her nightstand every night. Small changes, but she made them, and she understands why they matter in a way she never did before. Tonight, pick one of these 5 and change it. Just one. You do not have to do all 5 perfectly at once. Start with the easiest one for you. Maybe that is darkening your bedroom. Maybe it is drinking that glass of water before bed. Maybe it is writing down those 2 questions for your doctor. One change tonight is infinitely more valuable than 5 changes you plan to make someday. If this gave you something useful, and I genuinely hope it did, share it with someone you care about. And if you would like more honest, practical conversations about protecting your health after 60, subscribe. There is a lot more worth talking about.